Today we are reporting 395 new COVID-19 state of South Dakota. This does include 20 new hospitalizations, one new death, that's among a Union County resident, and 221 individuals who have recovered to the point where they're no longer able to transmit COVID-19, and a total of 2,917 new tests that have been reported. I do want to just provide a quick update from yesterday's high of 5,690 total tests that have been reported. So that does include some catch-up reporting that we had from at least one facility from around the Black Hills area. And so I know that there have been a couple of questions related to that, and wanted to make sure that folks understood that the increases that we were seeing in yesterday's testing include negative results that have been reported to us over the past, or negative results that were reported to us that should have been reported over the past 3 to 4 weeks. The total COVID-19 cases in the state is 17,686. Of those, 2,615 are considered active infections. We have a total of 14,878 individuals who are recovered. Our current hospitalization, we have 138 individuals, and total number of deaths, we are now at 193. The total number of tests that have been reported to the South Dakota Department of Health since the beginning of the COVID-19 pandemic now includes 234,778, and that is among 171,526 unique persons. I do have an update for our clusters for today. Wanted to let folks know that we have seen a cluster in the South Dakota Women's Prison. We currently have 105 total COVID-19 cases, and 3 of those individuals have recovered. Also wanted to provide some information on number of hospitalizations since we have been seeing higher numbers of hospitalizations. And one of the things to keep in mind is that this is all still well below our hospitalization bed capacity that we have available in the state. So you can go ahead and take a look at the dashboard, and you can see the total hospital beds, total ICU bed capacity, and the total mechanical ventilator capacity, and the percentage that are due to COVID, due to other conditions, and that are still available. But the information that I wanted to provide on hospitalization is just a look back at where we are. So as of Tuesday the 15th, we've had a total of 1,194 total hospitalizations, and that includes 18 that were identified in March, 181 that were identified in April, 185 identified in April, 254 that were identified in May, 229 that were identified in June, 152 that were identified in July, 212 identified in August, and 144 that were identified and reported in so far. Again, this information is as of September 15th and can also be found on the archive of our COVID-19 update that will be pushed out later today or tomorrow on South Dakota Department of Health website.
Thank you, Dr. Clayton. Now we are going to open the lines for any questions. Again, I will remind you to mute your line unless you are asking a question. First question, please.
Jody Heemstra, Dakota Radio Group
Trevor
here.
Mitchell with the Argus Leader.
Go ahead, Jody.
Thank you. What information can you share with us about the cluster at the women's prison here in Pierre? Social distancing, spacing, how are those things being handled? And all of the cases in 1 or 2 particular units? What are the logistics there?
Jody, this is Secretary Malsom Risden. I would encourage you to contact the Department of Corrections for the information that you're looking for there. They are working very hard on the response, and we'll be able to answer those questions.
Thank you.
Next question, please.
That's Trevor Mitchell with the Argus Leader.
Go ahead, Trevor.
Yeah, I'm wondering with those clusters increasing in the women's prison, is surrounding counties, Hughes County, Stanley County, seeing any increase in cases as a result of that? Staff, things along those lines, taking it outside, or is it too early to see things like that?
So, what I can say is that, we have kind of seen some general increases, all throughout the state, and we're seeing a little bit of that, pullback. In total, just for today, we are reporting a total of 89 cases for Hughes County, but, that is, the majority of those cases are associated with the women's prison. In total for Hughes County, we've had a total of 268 positives, and that's information that's available on the South Dakota Department of Health website. We have not, seen any additional increases that we've been able to that we would consider associated with the South Dakota women's prison. But we continue to monitor the situation as we've seen other clusters in the past.
Okay, thank you.
Yes, Ben Chase with the Huron Plainsman.
Go ahead, Ben.
Yes, just curious with the women's prison cluster, how is that being figured as far as numbers? Are the inmates being considered as residents within Hughes, or are they still considered residents within their permanent place of residence?
They are considered residents within the state of Hughes, given that's where their current test results arose. And so, if we have individuals that are released, back to their home residence, then that would be reflected, later on throughout the investigation. But, right now those cases are associated with Hughes County.
And I might just add, Ben, this is Secretary Melson Rice, and the reason for that is because Hughes County is their temporary residence that we associate the case with.
Yeah, and the one thing that I will lastly mention, and this is more of an investigation detail, is just that as those results have come in, if there's their prior address, it might be reflected in a pre-existing address until we've been able to finalize the data for those cases. And so just recognize that we're working to update the actual location in which they were residing when they were tested. The way the system works is, we do have individuals' address location, maybe perhaps from prior testing as one example of the way that we would have that information, and we want to make sure that we are associating it with Hughes County.
Next question, please.
This is Morgan at the Rapid City Journal.
Go ahead, Morgan.
Is this the first time you've done mass testing at any of the prisons? And if so, what were the results of those other testings? Will you plan for more mass testing at these kind of facilities?
So, Morgan, again, I would direct you to the Department of Corrections for details about the testing that they're doing. They've been testing folks for some time, consistent with CDC and other guidelines, but they could give you the details on that.
Okay, and if I could have another question. With this outbreak in some of the sports canceled in Pierre, is Pierre considered a hot spot right now, and is the state government doing anything different with the cases happening in the area? Is anybody working remotely? Can you share maybe how many state workers are quarantined?
Well, I can't speak for the school's decisions, and I think that's really what you're kind of referencing there, other than there are a number of students that are currently quarantined because they're close contacts of positive cases. And so been some decisions made around, school attendance and other activities based on that specific population. State agencies have been responding to COVID since the beginning of this, and so they're are various things in place to help keep state employees safe.
But just with the surge in cases, is there any like new guideline or new response to the kind of, I mean, would you consider Pierre a hotspot right now? Like, what's your thoughts?
That the hotspot in Pierre is specific to the cluster at the women's.
Yeah, and what I would also mention is, take a look and keep an eye on the COVID-19 dashboard, which will list all of the communities that are experiencing substantial community spread. That designation is used to identify where we're seeing elevated number of cases within the state of South Dakota.
Okay, and then if Dr. Clayton, I could bug you again for one more question. What were you saying earlier about the place in the Black Hills not reporting their tests on time? What was that about? I'm sorry, I was confused when you mentioned that.
Sure. So yesterday we had a larger number of total tests. We had 5,690 tests that were reported. A large proportion of that was a facility in the Black Hills that was reporting negative test results that had not been previously reported to the South Dakota Department of Health. And so we've incorporated that into our overall testing totals, and that will be reflected on the current data that we're pushing to the website today.
Can you say which facility that was?
We don't identify individual facilities, but it does serve as a good reminder that when we're pushing information to the website, all of that data is considered provisional, and that we are updating that on a constant basis based on what we're receiving from submitters.
Thank you.
Next question, please.
Deb with the Black
Todd Epp,
Pioneer.
Yellow.com News.
Go ahead, Deb.
My question is, I've heard some conflicting information about the school's role in contact tracing. And, I heard Morgan's question on Monday and the answer. But then when I went to the school board meeting, the superintendent in the Meade district said their administrators are spending days on contact tracing. What is the protocol going forward? I was told that the Department of Health is not going to confirm with the district that individuals were contacted. Is that true or not true? Or
So thanks, Deb. This is Secretary Malcolm Rice. And so just a couple of reiterations here. So the Department of Health is continuing to do contact tracing around close contacts of school positive cases. Schools are opting to help us with that process by identifying potential close contacts. So I believe that's what you're referencing when school personnel are talking about the time that it takes.
correct?
That's very true. And so that's been a very helpful process to help our staff be able to contact those close contacts, in a timely. So it's a collaborative process in that regard. Does that answer your question?
So are you saying that they just want to get the information out sooner, or
Sure.
are you
Yep.
still going to let them know that people have been contacted on contact lists?
Yeah, so the way the process works is if schools are helping us identify those potential close contacts in the school setting, they produce a list of names. We walk through that list with them to make sure that we understand the circumstances, the names on that list. We do the contact tracing and let those individuals know. Some schools are opting to kind of alert people that they may be considered a close contact. Again, to be proactive, and appreciate schools wanting to do that. The process that we're working on right now actually is then how do we close that loop so that schools understand when the contact notifications have been completed.
Okay, and is the same being done at universities? Like Black Hills State is doing their own tracing also?
Well, they're not really doing their own tracing. They're just helping with the information gathering. And
Okay.
yes, we do work with the universities in a very similar way.
All right, thank you.
Next question, please.
Todd Epp, Kello.com News.
Go ahead.
Thanks. Bear with me as I lay a little history. When Governor Noem ran for governor 2 years ago, she said that she was going to improve transparency of state government. And she once again reiterated that the other day in the news conference she held about the incident that the Attorney General was involved in where a pedestrian was killed. Considering that the first official word we heard about the women's prison was today, and the discussion of the Pierre school district situation, what does that say about transparency in state government? I mean, and let me also add and I know you guys have nothing to do with the Department of Corrections, but they had this information yesterday buried in their website on a link that looked nondescript. Unless you stumbled across it, you wouldn't find it. I mean, that doesn't seem very transparent. I'll stand by for your answer.
Well, this is Secretary Malcolm Risden, and I'll tell you that as it relates to COVID, I've put incredible amount of effort into making data, factual data that is, available on our website. So that's everything from what the latest guidance is so that people can stay safe to what the numbers are, you know, at the county level, the trend data. So the fact that we have regular communications with media to answer questions and try to help you do the best job possible with reporting on COVID in our state, I think is a testament to the transparency around COVID and other matters as a state agency. So I feel very good about the efforts that we've made, and those efforts will continue in good faith so that the people of South Dakota have the information they need to make a good decision.
So why didn't the department issue advisories like they've done for a number of private businesses in the state? I'll just use my hometown of Harrisburg as an example with Fresh Horses. Many, many more positive cases at the women's prison, and I'm not sure we still know how many cases are involved at Pierre Riggs High School. Why were there no advisories sent out about that?
So the public notices, which is what I think you're referencing, are issued in instances where there is a public exposure where we cannot identify the potential close contact. And so that would be the distinction between a situation in a business, for instance, or another setting where, you know, unnamed individuals would potentially be.
But in the case of the prison, I mean, the people that work there go home and they shop and go to church and go to things in Pierre, and then same thing with the staff and students at Riggs High. I mean, they're going out among the community. Don't you think the public should have known about these cases sooner rather than later?
Well, again, Todd, I would just remind you of the process that we use. And so if there was an instance where a positive case was in a setting where they were potentially exposing so that they could not identify, then we would, in fact, issue a public notice.
And I think the other thing to keep in mind is that we do update our numbers on a daily basis, so individuals, know how many cases are occurring within their community. Individuals, won't necessarily know where the next case is arising from, and who they may have been around, which is why, we do have a strong focus on making sure that individuals are taking proper precautions when they are doing, running errands and going to the grocery store or picking up medication at the pharmacy, or, going to school, going to work, and so on. So it really, to think that, just the number of cases that are kind of arising from in a single facility, which, yes, the large number of cases that we've had from that individual facility are larger than we've seen, just as a generality. But, when we're talking about cases within the community, that's really what should be driving individuals' focus on what actions they should be taking as they're in those communities.
So you're saying, tell me if I'm wrong, you're saying that as a citizen of Hughes County or Lincoln County or whatever, it's my responsibility to check the Department of Health website to see what the status of cases are in my county.
I would say that if you want to be informed on what's happening within your community, that you either take a blanket approach and take your individual precautions, with regardless of the level of community spread or the number of cases within your community, and or you keep up with the number of cases that are occurring. I mean, I think that's the main reason why we're working with providing information on our website, hosting these twice weekly conference calls, and working with you to get the word out about the number of cases that we are experiencing within communities so that people understand what their level of risk might be.
Okay, thank you.
Next question, please. Hearing no
Jody
one.
Heemster, Dakota Radio Group, Pierre.
Go ahead.
Onto the cases, the cluster at the women's prison again. Just to clarify, the numbers, are those all inmates, or is that total inmates and staff?
That is total. That is includes all cases that we've had in there, and that is all inmates. Have had a couple of staff in there as well. So, but yeah, the vast majority. I mean, this is focused on testing a large number of individuals. It's a mass testing event, so we did test a large number of folks. We did have positive staff and positive inmates as well.
Okay, so staff is included in that number. Thank you.
Yep.
Next, we have time for one more question, please.
This is Kelly Volk with Kello TV.
Go ahead, Kelly.
I just want to clarify, is the 105 cases from the Pierre Community Work Center, is that the women's prison, or are those two different tallies?
So the work center is a component of the women's prison. It's a separate building on the same campus.
Okay, I just wanted to clarify that. Thank you.
You're welcome. We would like to thank you all